Hi, this is Kelly with 100.3 KISS FM, and as you've heard on air, thanks to High Point Clinical Trials, you can score $1,000 every single hour, Monday through Fridays, and I am here with Clay at High Point Clinical Trials. As we already discussed through our other video, which you can check out online at 103kissfm.com, you can learn more about High Point Clinical Trials. And also I want to discuss with you, Clay, about the device that you have right now in your clinical trial. A little bit, tell our listeners about it, what you're doing with it, what's it for.
Absolutely. So here at High Point Clinical Trials, we do both drug and device studies. We currently have a device study running for a device that measures the electrical activity of the heart and the cardiovascular system. And it's an improvement over what's on the market right now. So we've all had friends, loved ones, we know somebody who has gone into the hospital with chest pain, and maybe it's something to do with their heart and maybe it's not. And what this device can do is give a better indication of whether it's something really serious or not, where what is used right now would be an ECG, and if there's a finding on an ECG, an electrocardiogram, they would be sent for further testing, which can be like a stress test or something more invasive where they're having to inject medications into their system to assess the arteries that feed the heart, for example. And what this device can do is actually go beyond what an ECG can measure and actually map out the electrical activity of the arteries as well, so that they can move faster from a finding to treatment, like going to the cath lab potentially or into surgery. So it's a device, it's an investigational device, and it's very needed. We're looking for healthy people that have no conditions, because in order for this device to get to the market, we have to have a big library of data from healthy people so that we can tell on those readings what a healthy person looks like compared to somebody that has a condition. Okay, and you are looking for volunteers right now for that? We are. It's a study that is a very short commitment for the participants. It's a single visit, so when they come in and they go through the consenting process that we spoke about in the other video, and they decide if it's something they want to participate in, they would go right into the study visit, collect the reading through something very similar to an ECG with the tabs on their skin. And once that's done, they would be finished with the study. We would pay them at that visit, and they would have no further commitment at that point. Okay, and that's a pretty easy peasy, like that's a quick one right there. It is a very quick study. Yeah, and compensation is available too for that. So if you are interested in participating in this study, if you know anyone in your family that's had a heart attack, I mean, this is very important in our community. Absolutely. What would you say, I mean, what's the biggest thing about this study for our community? Like the most important thing, I guess? Absolutely. So the compensation is there for the participants to compensate them for their time and trouble, and that's certainly, we want to provide that to them. But I think more importantly is the contribution that it makes to medicine and the potential for everybody to benefit from that, and and very altruistically everybody will benefit, and hopefully I'm one of those people, and just the way the participants will be as well. Awesome. So thank you so much for talking with me today, Clay. And if you are interested in participating in a study with High Point Clinical Trials, make sure you check out their website, highpointclinicalctc.com. And just make sure if you have any questions, you can also call them at 855-687-4257.